Hey everyone, my name is Mohammad and we are the group 2. The assigned topic that we got is assessing the ears. So lend me your ears and let us know at how the different parts of your ears work together to make us hear sounds.
Our ears are made up of the external ear or the outer ear, the middle ear, and the inner ear. Our outer ear is made up of the part of the ear that you can see. This is called pinna and the ear canal. So the cup-shaped pinna pick up sound waves from the environment and sends them into the ear canal. On the other hand, the middle ear is an air-filled space called a cavity that holds a chain of 3 bones. These bones include the hammer or what we call the malleus, the anvil or the incus, and the stirrup called the stapes. So the vibration of the eardrum starts a chain of vibrations through the bones because of differences in the size, shape, and position of the 3 bones. So the force of the vibration goes up by the time it gets into the inner ear. This rise in force is needed to transfer the energy of the sound wave to the fluid of the inner ear. The inner ear contains a group of interconnected fluid-filled chambers. The snail-shaped chamber called the cochlea plays a role in our hearing. Sound vibration from the bones of the middle ear transfer to the fluids of the cochlea. Sensors lining the cochlea, called hair cells, change the vibration into electrical impulses that are sent along the auditory nerve to the brain. This is where the damage and hearing loss first happen. That's due to age, noise exposure, or medicine. Right after the eardrum vibrates, the ossicles also start vibrating, transporting the vibrations from the eardrums to the inner ear. So moving on otoscope. This otoscope is a handheld tool used by a healthcare provider to look inside the ear during an ear examination, or what we call otoscopy. So a provider may conduct an ear exam during a routine wellness visit or on people experiencing symptoms. So during an otoscopy, a provider will check for signs of infection, injury, or other ear problems. Moving on to the types of hearing loss. So in types of hearing loss, we have hearing, which are the conductive hearing loss, sensorineural hearing loss, and the mixed hearing loss. Starting off with conductive hearing loss. So this type of hearing loss occurs in the outer or middle ear where sound waves are not able to carry all the way through to the inner ear. Sound may be blocked by earwax or a foreign object located in the ear canal. The middle ear space may be impacted with fluid, infection, or a bone abnormality, or the ears may have been injured. In some people, conductive hearing loss may be reversed through a medical or surgical intervention. Conductive hearing loss is most common in children who may have recurrent ear infections or who insert foreign objects into their ear canal. On the other hand, sensorineural hearing loss is the result of damage to the inner ear, the auditory nerve, or the hearing sensor in the brain. So this type of hearing loss occurs when the inner ear or the actual hearing nerve itself becomes damaged. This loss generally occurs when some of the hair cells within the cochlea are damaged. So, sensorineural loss is the most common type of hearing loss. It can be a result of aging, exposure to loud noises, injury, disease, certain drugs, or an inherited condition. This type of hearing loss is typically not medically or surgically treatable. However, many people with this type of loss find that hearing aids can be beneficial. The mixed hearing loss. So, sometimes people can have a combination of both sensorineural and conductive hearing loss. They may have a sensorineural hearing loss and then develop a conductive component in addition.
So let's move on in assessing the ears in hearing. In assessing the ears in hearing, approach the examination in a systematic way. Magsa-start ka sa outer parts ng ear, then move to the inner part of the ear. In assessing the external ear, there are 2 ways, via inspection and palpation. In inspecting the external ear, you should note the size, shape, and position of the auricle, tragus, and lobule. So we have here some of the normal findings that we can see in assessing the external ear. Ears should be equal in size of 4 to 10 centimeters. Auricle aligns with corner of each eye within 10 degrees of the vertical position. Earlobes should be free, tightly attached to the skin or soldered. Skin should be smooth, no presence of lesions, lumps, nor nodules. So, we can also assess the color consistency of the ear with the facial color of the patient because most hypertensive patient has a very red ears. Also, the normal variation in this include the Darwin's tubercle, which we will tackle later, and the ear should be no discharge present. In this illustration, we can identify the normal alignment and the deviation in alignment or the abnormal alignment of the ear. So the top of pinna should match the imaginary line extending from the corner of the eye to the occiput within 10 degrees of angle of the vertical position. So makikita natin sa normal alignment that the angle is within 10 degrees, and wherein sa abnormal alignment of the ear is that more than 10 degrees of the vertical position of the patient. We have here the variations of the earlobes, which are the soldered, attached, and free. So sa soldered, makikita natin ng earlobes ng isang patient is not hanged, and sa attached earlobes is that earlobes are partially hanged, and sa free is that earlobes are totally hanged. So these are normal variations of the earlobes. We have another variation of the ear, which is the Darwin's tubercle. Darwin's tubercle is a atavistic swelling of the posterior helix that is present in some individuals. So it is a normal variation in human ear anatomy and is usually not associated with any health problems. It could be inherited or as a result of unequal turning in of the helix in the fetus. So let's move on with the abnormal findings in inspecting the external ear, wherein ears are smaller or larger than normal, malaligned or low-set ears, same sa pinakita ko kanina, pale blue ear or frostbite, the enlarged lymph nodes, tophi or gout, black sebaceous glands, ulcerated and or crusted nodules that bleed, are associated with skin cancer. Redness, swelling, scaling, and itching are also associated with otitis externa. We have some of the abnormalities of external ear that we are going to tackle in this presentation, and one of them is pale blue ear or frostbite. Frostbite is a skin damage that happens in freezing temperatures. Symptoms include pain, numbness, and skin discoloration. It is a severe damage to the tissues from temperatures below 95 degrees Fahrenheit and 35 degrees Celsius due to the formation of ice crystals within cells, which ruptures the cells and leads to cell death. We have stages of frostbite in this illustration. The first one is the normal appearance of the ear. On its right side is the frost nip or first degree injury, and below are the second and third degree injuries of the frostbite, which are the most severe form of frostbite. Treatment for frostbite in the ears involves rewarming the affected area gradually, avoid rubbing or massaging, and protecting the ears from further cold exposure. Additionally, pain management dressings and possibly medications to improve blood flow may be prescribed. In severe cases, surgery or hyperbaric oxygen therapy might be necessary. The hyperbaric oxygen therapy involves breathing pure oxygen in a pressurized environment or chamber. Next one is malaligned or low-set ears. So in this illustration, we can identify the normally developed ear and the low-set ears. So actually, the low-set ears or malaligned can either be normal and abnormal variation of the external ear. For low-set ears can be considered normal in approximately 80% of cases due to genetic variation, developmental factors, or benign conditions such as positional molding in newborns. Additionally, certain ethnicities may naturally have lower set ears, contributing to their prevalence. The next one is tophi. These are hard nodules containing uric acid crystals. Tophi in the ears typically form due to chronic hyperuricemia, a condition where there is an excess of uric acid in the blood. Factors contributing to this condition include genetics, diet high in purines found in certain foods like red meat and seafood, alcohol consumption, obesity, kidney dysfunction, and certain medications. Treatment for tophi in the ears often involves managing the underlying cause of hyperuricemia, typically through medications such as allopurinol or febuxostat to lower uric acid levels. In severe cases, surgical removal may be necessary. Lifestyle changes like diet modification and reducing alcohol consumption can also prevent recurrence. Another one is sebaceous cyst. Unlike tophi, sebaceous cyst is painful nodule. In the sebaceous cyst in the ears is mainly caused by black sebaceous glands resulting in the accumulation of sebum. These cysts can also arise from infections or inflammation of the hair follicles. Treatment for a sebaceous cyst in the ear may involve warm compresses to reduce inflammation and encourage drainage, but surgical removal is often necessary for complete resolution. Another is carcinoma. It is ulcerated nodule with clear borders. Carcinoma in the ears can result from chronic sun exposure, particularly in individuals with fair skin, as well as from exposure to carcinogens such as tobacco smoke, or certain chemicals. Additionally, genetic predisposition, immunosuppression, and chronic infections can also increase the risk of ear carcinoma. Treatments include the surgery or the therapy, or can be both as the treatment, or can be both. The last one is keloid. Keloid are formed rubbery fibrous nodules that form on the ear after minor trauma. Keloids in ears result from overgrowth of scar tissue after trauma, piercings, or surgeries. Genetic predisposition, increased collagen production, and inflammation contribute to keloid formation. Individuals with darker skin tones are more prone. Treatment involves corticosteroid injections, surgery, or laser therapy, but recurrences are common. So let's move on with the palpation of external ear. In palpating the external ear, first examine the unaffected area and palpate the auricle and mastoid process. One thing in knowing the normalities in palpating the external ear is that the auricle, tragus, and mastoid process should be soft and non-tender, and the movement should produce no pain. For the abnormal findings in palpating the external ear is that the pain produced by palpating the auricle and tragus is associated with otitis externa, and the tenderness over the mastoid process is associated with mastoiditis. Mastoiditis is the result of the complication of the untreated otitis media, wherein otitis media is the tenderness behind the ear.
So moving on to external auditory canal. Ang external auditory canal ay isang bahagi ng tenga na nagpapadala ng tunog mula sa labas papasok sa eardrum. Ito ay isang daan na mayroong manipis na balat at mayroon ding mga glandula na nagpo-produce ng airwax upang to protect the ear sa bacteria, alikabok at iba pang mga bagay na maaari makapasok sa loob ng tenga. To assist the external auditory canal, first, inspect the outer aspect of the external ear canal using the otoscope as a light source. Next is gently straighten out the ear canal by pulling the external ear superiorly and posteriorly. Then, look for sign of wax o kahit anong bagay na hindi dapat nandoon tulad ng alikabok o kahit anong ibang bagay na maaaring maipit sa loob ng tenga. Pangalawa ay ang pagbabago sa kutis o erythema na maaaring magpakita ng anumang pagbabago sa kulay o kondisyon ng balat sa labas ng tenga na maaaring maging sign ng infeksyon o iba pang kondisyon. Pangatlo is pagdudugo o anumang liquid na lumalabas mula sa tenga na maaaring maging sign ng infeksyon o iba pang problema sa tenga. So moving on sa normal findings, we expect that our auditory canal may have a small amount of wax, shouldn't be black or draining purulent, should not be flaky or hard. Wax there should be soft and moist. The ear canal wall should be pink and no nodule should be noted. Nodule is abnormal tissue. Next is the abnormal findings. So some abnormal findings might be if there is foul smelling, yellow discharge. Those things can be related to otitis externa, which is discussed later on. Any bloody purulent drainage, again related to some of those infections. We note that any watery drainage or bloody drainage can be connected with trauma. That watery fluid, especially if it's a serous fluid, can be related to some cerebral spinal fluid. Maybe that's leaking if there's head injury, so be aware of that because that is something we look for. So impacted cerumen could affect the patient's hearing. Any foreign bodies must be removed. So let's proceed to abnormalities of external auditory canal. First is otitis externa. Ang otitis externa is infection na nagdudulot ng pamamaga at pamumula ng ear canal. Pangalawa is otitis media with ruptured tympanic membrane. infection to sa middle ear na nagdudulot ng pamamaga. Ang pinagkaiba nga lang niya sa kay otitis externa ay may build up of fluid behind the eardrum para siyang may nana na. Next is oral polyps. Ang mga polyps sa tenga o oral polyps ay isa sa mga posibleng abnormalities sa labas ng auditory canal. Ito ay mga maliit na bukol o abnormal na paglaki ng tissue na maaaring matagpuan sa loob ng tenga. Ang mga polyp ay maaaring magdulot ng discomfort, pagbabago sa pandinig, o pakiramdam na pumipigil sa loob ng tenga. Kung mayroong oral polyps, mahalaga na kumonsulta sa isang doktor para sa tamang treatment nito. Next is to assist the tympanic membrane. First is gamitin ang isang otoscope, isang medical instrument na may ilaw at lens na ginagamit upang suriin ang loob ng tainga. Pangalawa is ilagay ang dulo ng otoscope sa labas ng auditory canal at unti-unti itong ipasok ng diretso at maingat hanggang makita ang eardrum. Pangatlo is sa pamamagitan ng otoscope maaari matingnan ang eardrum at suriin ang kulay, anyo at kalagayan nito. Ang normal na eardrum ay dapat gray o transparent at mayroong maliit na hiwa sa gitna na tinatawag na pars tensa. Last is kapag nakita ang anumang palatandaan ng abnormality tulad ng pagkakaroon ng butas, pagbabago sa kulay, o pagkakaroon ng bukol, mahalaga na kumonsulta sa isang doktor para sa tamang treatment at pangangalaga sa ear. Next is normal findings in tympanic membrane. In the normal findings, tympanic membrane should be pearly, gray, shiny, translucent without bulging or retraction. Bulging is swelling. And mayroong maliit na hiwa sa gitna na tinatawag na pars tensa. Walang mga butas, punit o anumang malalaking pagbabago sa anyo ng eardrum. Walang mga nakikitang bukol, dugo o anumang liquid na nagmumula sa eardrum. Kapag nakita ang mga ganitong normal na kalagayan sa eardrum, karaniwang nagpapahiwatig ito na healthy at normal na pag-andar ng tenga. Moving on to abnormal findings. Some abnormal findings is may butas o punit sa eardrum, maaaring dulot ng trauma o infeksyon. At pagbabago sa kulay ng eardrum tulad ng pagkakaroon ng pula o namumulang bahagi na maaaring magpahiwatig ng infeksyon o pamamaga. Pangatlo naman is pagkakaroon ng bukol o cyst sa loob ng eardrum, maaaring magdulot ng pagbabago sa pandinig o discomfort. Next is pagdugo mula sa eardrum, maaaring sign ng injury, infeksyon o iba pang kondisyon. Kapag natuklasan ang anumang di karaniwang pagbabago sa tympanic membrane, mahalaga na mag-consult sa isang doktor upang mabigyan ng tamang pagsusuri at pag-alaga ang problema sa tenga. Moving on to the classifications of otitis media, we have serous otitis media, acute otitis media, secretory otitis media, chronic otitis media without cholesteatoma, tympanic membrane retractions, chronic otitis media with cholesteatoma. So, ang serous otitis media ay isang condition kung saan may build up ng fluid sa gitna ng tenga na maaaring magdulot ng discomfort or hearing loss. Ito ay isang uri ng pamamaga sa gitna ng tenga na maaaring mangyari dahil sa trangkaso, sore throat o respiratory infection. Karaniwan naman sa mga case na to is gumagaling ng walang gamot. Pero may instances pa rin na may time pa rin na need ng treatment. Next is acute otitis media, is isang kondisyon sa tenga na karaniwang nagaganap kapag ang middle ear ay nagkakaroon ng infection dahil sa bakterya. Ito ay madalas nararanasan ng mga bata. Ang symptoms nito is kasama ng pagsakit ng tenga, lagnat at hearing loss. Next is secretory otitis media. Ang secretory otitis media is isang kondisyon kung saan mayroong pagkakaroon ng liquid sa likod ng eardrum. Ito ay maaaring mangyari kapag ang Eustachian tube sa tenga ay hindi nagbubukas ng maayos, na nagresulta sa pagkakabara ng liquid sa tenga. Ang Eustachian tube is an opening that connects the middle ear with the nasal sinus cavity. Ang kondisyong ito is madalas na nangyayari sa mga bata, lalo na kapag sila ay may sipon or trangkaso. Next is chronic otitis media without cholesteatoma. Is a chronic otitis media isang kondisyon kung saan ang tenga ay palaging namamaga at palaging may infection. Next is tympanic membrane retractions. Dito naman is when the eardrum gets pulled inward, causing a visible depression. It can be caused by negative pressure, Eustachian tube blockage, or chronic ear infections. It can lead to hearing problems and should be evaluated by a healthcare professional. Then the last one is chronic otitis media with cholesteatoma. It refers to an ongoing infection and inflammation of the middle ear, which often leads to a skin cell growth called cholesteatoma. So ang cholesteatoma is an abnormal collection of skin cells deep inside the ear. This can cause long-term problems such as hearing loss and damage to the middle ear structures.
Let's move on to the assessment of hearing. So we have hearing test. So hearing test helps to discern sounds transmitted through air versus sound transmitted through bone. This comparison also helps to assess unilateral hearing loss. Hearing test can help identify the conditions that causes hearing loss. So examples of these conditions that cause abnormal hearing or Weber test include eardrum perforation, wax in the ear canal, ear infection, middle ear fluid, sclerosis or the inability of the small bones within the middle ear to move properly, and the nerve injury to the ears. So in hearing test results, normal hearing will show an air conduction time that is twice as long as the bone conduction time. In other words, you will hear the sound next to your ear twice as long as you will hear the sound behind your ear. If you have conductive hearing loss, the bone conduction is heard longer than the air conduction sound. Test, it is primarily used to assess patients with unilateral hearing loss and to characterize conductive versus sensory neural loss. Conducting Weber test, we are also going to strike the tuning fork against our elbow and place it on the patient's forehead in the midline. And we're going to ask the patient whether the sound is heard in the midline or has lateralized. For normal hearing, the sound is heard in the midline, meaning normal hearing will produce equal sound in both ears. For conductive hearing loss naman, the sound is loudest on the ipsilateral side to the hearing deficit, meaning conductive loss will cause the sound to be heard best in the abnormal ear. Lastly, in the sensory neural hearing loss, the sound is loudest on the contralateral side to the hearing deficit, meaning it will cause the sound to be heard best in the normal ear. Lastly, we have whisper test. It is a primary, simple, and accurate test for detecting hearing impairment. It evaluates the patient's hearing ability, particularly their capacity to hear low-level sounds or whispers. Conducting whisper test, we the examiner should briefly explain the test. So firstly, stand 1 to 2 feet behind client so they cannot read your lips. Next one is to instruct client to place one finger on tragus of left ear to obscure sound. Next is to whisper word with 2 distinct syllables towards client's right ear. Next is to ask the client to repeat word back. Repeat test for left ear, and the client should correctly repeat 2-syllable word.
And that's all for our discussion. Thank you for watching.